This program is supported by H.R. Clough and Kearsarge Heating. Their full-service model offers oil delivery, propane, motor fuels with design, installation, service, and maintenance of all types of oil, gas, and alternative energy systems, as well as air conditioning, water conditioning systems, and their highly trained and friendly staff will assist you throughout the process of buying, installing, and servicing a full line of energy products. H.R. Clough and Kearsarge Heating.
Welcome back to Yankee Chronicle. I'm your host, Abby Peel, coming to you from New London Hospital. We check in around this time every year because it's about to be hospital days. It's very fitting to be here. And I'm now joined by Tom Manion, the president and CEO. Hi, Tom.
Hey, how are you, Abby?
Thanks for hosting us, and it's great to check in with you every summer.
Likewise, yeah.
Great. We'll get right into it. We've seen a lot of press surrounding some financial impacts that Dartmouth Health is going through. How is New London Hospital handling that?
Yeah, no, great question. So, yes, Dartmouth Health has gone through a lot, and I think there have been a few of our members, probably most notably in the newspaper, Dartmouth Hitchcock Medical Center, that had some workforce restructuring.
Yeah.
And I'll just say, we went through something similar to this a couple years ago, and it was a hard time.
Yeah.
It was a very difficult time. It was very emotional. We had a lot of really great people that had to move on, and I'll say this: we had Dartmouth Hitchcock help us through that time, and as a result of that, we are in a much better place today. We are extraordinarily strong financially. We have a really great team here. Some of the services that we've been able to bring forward over the last couple of years has really just shown our partnership and why it's so important to be part of the system. So I think that this is something that, while Dartmouth as a system is going through some trying times, they were there for us. We'll absolutely be there for them, and we're continuing to work together and support each other. I will say things are pointing in a good direction already, and I feel pretty confident that we're on the right track as a system.
Wonderful. And also, I mean, it's not news to anybody. Shortage of staffing is a problem that we're facing not only in our town, our state, but across the country.
Yeah.
And how are you doing? Because you've talked about some of the primary care issues that New London Hospital's been having.
Yeah, no, it's true. I mean, primary care is a national shortage, and it's one of the things, if you talk to, I would think any hospital in the Northeast, probably nationwide, it's a challenge. And for a lot of reasons, it's a challenge just because there's fewer physicians going into primary care. There is a high burnout, turnover rate. But I think where we are today, I'm actually really happy to say we have a number of primary care physicians that we've hired. Internal medicine, both men and women, family medicine. We have nurse practitioners who'll be starting both here in New London and in Newport. It's just, we have a lot to look forward to. I'm really excited that again, we're on the right track. We have a lot of good things going in that direction. That's not to say it's easy to move to this area. I think there are, housing inventory still is an extreme shortage. I know some of the primary care providers who have had trouble finding homes. But I do know there are some, not necessarily for primary care providers, but for some of our support staff, clinical support staff, there's going to be some affordable housing, workforce housing, that will be built both here in New London and in Newport. That is underway. It hasn't been established yet here in New London. I think Newport is actually quite very far on the way.
They are. Yeah.
And so I am very excited for that. We desperately need that kind of housing to support our caregivers and the people who are here to make sure we're treating patients and keeping them healthy.
Yeah, and the message to any young viewers, consider a job in healthcare.
Yes, please, absolutely. Well, and actually on that note, I mean, we've started a bunch of different programs here where we help people from, if you are coming out of high school, there are these LNA programs that we partner with. There are these programs with Colby-Sawyer College, with we just offer tuition reimbursement and other things where if you want to start a career, and we actually have some folks who have gone all the way through being a clerical worker in a file room who are now a nurse practitioner and have gone through that career trajectory. it's pretty cool to see how you can grow here at New London Hospital. And there's a number, that's just one story, there are a number of stories, and we're continuing to invest more and more in our people every day.
It's so important too, and what a program where kids can be 17 or 18 years old and already be on their way. I mean, I at 17 or 18 did not know what I was going to do with my life.
I think very few people do, but that's one of the great things. You can come here and you can start in a role, learn from a lot of other people who are professionals, and say, you know what, that's a really interesting career path. I might want to learn more about that. And you can grow and move and progress, and we're going to support you all the way through that.
Fantastic. And what are the funds from Hospital Days going to this year?
Yeah, so this year's recipient, the beneficiary of Hospital Days, is our infusion hematology suite. So we have nurses, multiple chairs, our pharmacy, and a whole host of services that come together in our infusion suite, and patients who get care, whether it's for oncology infusion, for cancer care, for rheumatoid type of care, medical infusion, other things like that. And so it's really an opportunity for us to look at how we improve the overall patient experience as you're getting that care. And if you know anyone who's gone through this, there are lots of things that you can improve along the way, but helping our nurses, to our facility, to other things that can make it better. It's a really great opportunity to do some good for our patients.
Wonderful. Finally, you have some recent exciting news about the Jack and Dorothy Byrne matching grant. Tell us about that.
Yes, super exciting news. So we have a wonderful, wonderful supporter in the Byrne Foundation, and so for this year's Hospital Days, we have a $50,000 match that they are working with us. Yeah, and so we are really on our way. Probably around halfway there, and so now kind of moving out into the more public facing. We've just done some press releases and other things. We really are excited about this, and this will be huge for our infusion services, so hematology, oncology, cancer, medical infusion. We're so grateful for our sponsors and for everyone else who's going to help support us in Hospital Days. Come out, have some fun, but also help us do some really good things for our patients and our community.
I have to say that Jack and Dorothy Byrne Foundation is uncomparable. It is just amazing what they do and give back. And they clearly see that this is such an important organization to support. So fantastic news, and congratulations to New London Hospital.
Thank you.
Tom, always great to sit down and check in with you. And obviously we're getting ready to start the parade soon. And Hospital Days weekend is going to be here before you know it. It's always a little bittersweet though, because it's August. It means summer's wrapping up a little bit, but it's such a great celebration here in New London, and thank you for being the host of it.
Absolutely. Can't wait to do it.
Great to check in.
You too.
Coming up next, we'll head over to the New London Historical Society grounds to hear about a tasty event they have coming up. Stay tuned. We'll be right back after these messages.